Hello, my name is Kevin Sykes. I'm a research assistant professor at the University of Kansas. The work I'll be talking about today is the fruit of a valuable partnership between KU Health Outreach Foundation and a Dominican-based NGO called Puente. I think everyone's familiar with the concept of a medical service trip, or what's sometimes called a medical mission. I've been working for the last few years to understand the best way to help organizations that perform these trips to positively impact the communities they serve. A recent study estimated that US-based MSTs spend approximately $3.7 billion per year. Interestingly, there's very little to show for that investment in the medical literature, and some even challenge the utility of these activities altogether. What we're attempting to do is empower medical service teams to capture data and track outcomes in their patients. Our pilot project included a program to utilize mobile-based data collection tools in the clinics associated with an MST in Constanza, Dominican Republic. Clinical data, including diagnoses, medical history, blood pressure, and blood glucose, were documented during the clinic visits with local physicians and members of the MST. After completing the clinic visits for this trip, we randomly assigned participants to either receiving active follow-up or being seen according to the standard MST model without active follow-up, but with the opportunity to see our team again in July. The active cohort consisted of 65 patients who received monthly visits in-home from the Puente team. During these visits, the team again recorded blood pressure and blood glucose levels through point-of-care testing. These visits continued over the next 6 months, and during that period, we were able to capture these test values 3 or more times on 92% of the participating individuals. The cost for the two MSTs during the study period were approximately $22,000. Adding the use of the mobile data collection platform, including the in-home visits, only added around $1,700 to our cost. So what we're doing here is building on the shoulder-to-shoulder model by working with local providers in their own communities to supplement the services they provide and enhance them with a mobile platform for population monitoring. Future studies could use the same platform to evaluate interventions for chronic diseases or emerging community health problems. Finally, this platform and outreach adds less than 10% of cost to the overall annual MST budget. We believe our work demonstrates that longitudinal population health monitoring is feasible and affordable in low-resource settings using GPS-enabled mobile health technology. We would suggest that MSTs develop mutually beneficial partnerships with local providers as the first step toward improving this model of healthcare delivery. But we'd also suggest identifying technology partners who can support the development or deployment of mobile technologies as a means of tracking outcomes of interventions performed during these trips. Thank you so much for listening. Have a great day.